Hey everybody, we'll start again. This is where'd he go? Nick Mancuso, Dr. Nick Mancuso. He is a second year, soon to be third year in what, like 2 weeks. So one of the rising stars in the department. He's going to talk about some summertime stuff since it's coming up to summer. So Nick Mancuso.
All right. So I'm going to talk about summertime exposures, some of the common things we see, a little different, specifically, I guess, for the summer. Since we're getting into that time of year, not to be confused with southern exposure or the other southern exposure. I didn't realize there's like 8 southern exposure albums out, but apparently there are. So 2 things in the summer we experience more than other times of the year have to do with heat and water. So obviously it's hot in the summer, except for days like today. And when people get hot, what do? They go try to find water. So what can happen with these 2 things? What do we need to know? And what can we do about it? So in terms of heat, there you can gain heat and you can lose heat. So ways we gain heat are two big ways are metabolic. So the body's metabolism itself, any kind of physical or strenuous activity generates heat. And then you can also obviously get heat from the environment itself, which is why the summertime can be so dangerous, because it's hot on top of everything else your body is doing. Your body temperature can increase more. And then the ways the body can lose heat are these 4 things, which I'll talk about a little bit more detail specifically with the human body, which are radiation, conduction, convection, and evaporation. And trying to find the balance between these 2, just like everything else the body does, is important. When it becomes deranged is when we have issues. So the way we get rid of all the heat that we make by whatever it is we're doing, first one is radiation. So the way we do that is we can dilate our blood vessels peripherally, and it only works up until your body temperature and the like ambient air temperature is the same. After that point, when it's warmer, the air temperature, this doesn't work really at all. You don't lose any heat this way. So in summertime, when you're outside and it's above whatever 98 degrees, you can no longer lose any heat from radiation. Next is conduction. This is when you are in direct contact with something. So you get in the swimming pool, the water's cold, your body cools off, or you, I don't know, lean up against a hot metal object in the sun, and like a snake, you absorb all the heat. Convection is another way we lose heat. This has to do with air and water circulating across the body. This is not direct contact, but this is more of an airflow. So think about like the wind blowing and like cooling you off or something, or I don't know, you're in some kind of a sauna and the water's just constantly moving around, creating this gradient that you lose heat across. And the last and one of the most efficient ways we lose heat is by sweating, evaporation. And the human body does that by sweating, which we'll get into later in terms of some treatment for some of these things. One of the best ways to treat different heat emergencies, and what we do in the ER a lot of times, is try to get people to evaporate. This is a picture, obviously, of the Amazon. These things work, only up until a certain point where we have to worry about extreme heat or extreme humidity. Then you're kind of stuck. And the human body, just like everything else we do, can acclimate to heat. It's kind of an interesting process. I'm not going to talk about it too much, but essentially, people who live in these warm climates, people wonder how they can survive and how there's not more emergencies and deaths and things, and how do we used to survive without AC and all this stuff. So the body can actually acclimatize, which is a fancy word for whatever, I guess getting used to something. It takes a few weeks, but eventually you can actually adapt to your environment. It's kind of a complicated process, but at the base you secrete this enzyme, or a hormone called aldosterone, that reduces the amount of salt you actually lose in your sweat. And this takes time. So eventually you'll start to reduce your sweat loss, which is important because you still lose water, you still sweat a lot, so you evaporate more, and that helps keep you cool. But you're not losing all your sodium. All your sodium you're keeping in your body, so your intravascular volume stays elevated, you stay well hydrated, and you don't pee as much. So you kind of hold on to water more. And the water that you do use, you use efficiently to evaporate and cool you. So bottom line is you sweat more, you have less salt in it, and you are able to evaporate and lose more heat by evaporation. This is another little table I found. I think the Weather Service put this one out, and you can see how things vary just by the relative humidity. So say it's like 90 degrees outside, it's not very humid, it feels like it's like 91. But as soon as you get up even to like 60, 70% humidity, it starts to feel like, you know, your body experiences 100, 103. And as it becomes more humid, as it tends to in Kentucky, you can get up pretty hot. I guess that's what, 23 degrees, like 20 plus degrees more, just based on how humid it is outside. And then it kind of breaks it down into how dangerous each one of these is for humans. So not too dangerous, use some caution, common sense. Then once you get up here in this darker, I guess, yellow and orange, you can suffer some serious side effects. So what are some things that happen with heat? Starting with kind of the least serious type thing, you can get heat cramps. So people get cramps specifically in some of their like core muscles, shoulders, calves, and thighs seem to be the most commonly reported. Usually associated with physical activity, and your body temperature does not change from its baseline, which is 36 to 38 degrees Celsius. If you ever come across someone that's got these symptoms, whatever they call for help, or you just see them out in public or something, the treatment is just keep them all hydrated, get them somewhere cool. Usually they don't have to come into the hospital for this if you're pretty sure that's all that it is, and they kind of have these classic symptoms. Kind of the next step up is heat exhaustion. So this is when you get a little more fatigued with it and you have more kind of systemic symptoms. You've got these cramps maybe, but a lot of times people just get kind of tired. They get lightheaded, nausea, vomiting, almost flu-like symptoms. So sometimes it's difficult to tell. Usually they also have normal temperature too. Sometimes it can be a little bit elevated, but most people that get heat exhaustion, their core body temperature stays 36, 38 degrees. Treatment for this is, the recommendation is bring them to the ER if you get a call or find someone like this. IV fluids, usually they need IV versus PO because they're a little more dehydrated. And you can cool them if you need to, even if their core body temperature is normal. They tend to feel better and recover faster if you do kind of these cooling methods that I have listed there, like ice packs to the groins, fans, misting patients. Sometimes this can be hard to tell if this is just heat exhaustion or something more severe because some of the symptoms kind of overlap. So we always kind of look and worry about what I'll talk about next, which is heat stroke. And on the way to the hospital, they need essentially just basic pre-hospital care, make sure they're not feeling this way because they've got like a low blood sugar or something like that. So that's heat exhaustion. Then last thing is heat stroke. This is more severe. This is truly an emergency. Essentially the body gets to the point where it cannot keep up with how hot it is, the core temperature. So you get end organ damage. Your temperature goes up, you can't control it any longer. And that's supposed to say sweating, not whatever, serrating. And the ultimate poor outcome or complication of this is cerebral edema that can lead to death, obviously. So this is when you have, excessive heat, excessive sodium loss. You can get hypovolemic, although a lot of these patients are not super volume depleted, so you can be easy with fluids, especially in older people that have symptoms of heat stroke. You don't want to give them a ton of fluid and just overload them because they're really not that volume depleted. The issue really is from the heat and the acidosis that they develop and the end organ damage that they get. Fluids help out some, mainly for the acidosis, but it's not the key thing that they kind of need. classically, they get this respiratory alkalosis, and then they get a metabolic, usually just a lactic acidosis. So whenever we send off labs, that's kind of what we're looking for. It tips off that, yeah, this is like heat stroke. As the name implies, you get stroke-like symptoms with it. Most commonly, you get ataxia, so difficulty with like balance and kind of walking around, I guess. It's also more common in the elderly. Typically, like younger people don't get heat stroke, so it's very difficult sometimes to, when you're transporting them, try to figure out, is this a stroke? Is this heat stroke? Is this some other like sepsis or metabolic abnormality? It can be different, so you kind of have to use your clinical picture. Obviously, they've been outside in the heat, and you take the temperature, and they're above typically 40 degrees or 104 degrees Celsius. That's kind of the cutoff for minimum temperature for heat stroke. So what do we do about it? Definitely an emergency, so bring them to the ED. Just like everything else, airway, breathing, circulation. Put them on a monitor, give them a little bit of fluid, not a lot. And just like everything else, check basic stuff, finger stick, make sure they're not drunk, intoxicated, make sure that it's not, med list is important for these because sometimes different medicines can cause you to get hyperpyrexia or temperature to go up, especially in older people on a bunch of stuff. So it's kind of important to know. And then when they get to the ED or even on the way, we treat them essentially the same way that EMS does because there's not a whole lot to do for it to try to cool them. Everyone does the same thing. You want to get them undressed. One of the most efficient ways, multiple studies have shown to cool people, is to mist them with water and like put a bunch of fans like on the bed or around them and blow it off and try to get them to loose heat by evaporation. You can also do the same thing, ice packs to the groin and axilla. Be careful with fluid. And a lot of people want to just give them Tylenol because they have a fever. Why not give them Tylenol? And it does not help in heat stroke. It does not lower the temperature because your kind of central nervous system is what is kind of off and not working. So Tylenol won't work by the same mechanism that it usually does and really won't do anything at all for you. The goal is to get them down to 39 degrees Celsius, which is 102 degrees. So this is something that I think it was Sacramento or San Diego, Sacramento, EMS put out a graphic that kind of talks about heat exhaustion versus heat stroke. They have this like public service kind of campaign to educate the public on what to look for, reasons to call EMS, and kind of breaks it down nicely between heat exhaustion and heat stroke. As you can obviously see, very similar symptoms. Heat stroke is always usually more severe. And like I said, if you're 104 degrees, that's kind of the cutoff. For some reason here it says 103 on their little thing, but technically it's 104. And then when I was reading on this, I came across this exertional heat illness, kind of interesting, so I'm just going to briefly touch on it. This is essentially what they call it when you have, like, if you think of football players that pass out during practice or something. There's a big push several years ago. I remember early in the 2000s as well, I think back when I was in high school, about this heat exhaustion thing with people pushing football players and practicing 3 or 4 times a day, not having water breaks. They came up with this entire system now where you can go through and try to acclimatize players. I found this like protocol where it's really interesting. Like each week you increase the exposure to being outside, and they have like set times of water breaks. It's actually pretty cool and intricate system, so that by the time supposedly you're in midsummer and having practice, all the players' bodies should be acclimated better than just jumping out there and being out there every day for the same amount of time. So essentially I found that, over a course of like 5 years or so, there were more complications with this than any time in the past, essentially history. I guess they got around 9,200 calls total for this, according to the CDC. And the most common sport or cases of this occur in U.S. football players. 5 out of 100,000 players essentially can develop this. And 31 players have died, I guess, since 1995 that have been reported, which sounds kind of low. I'm sure it's more than that. This is a map that shows all the deaths from exertional heat illness. All the little circles within 50 miles of one of those circles are supposedly a death. So you can see Kentucky right there in the middle of kind of all a bunch of circles, mainly southern, southeastern states where it's more humid. So what do you do when you get hot? You go swimming in the swimming pool, or the ocean, I guess. So I'm going to talk a little bit about submersion injuries. This is very common to get a call about this throughout the U.S. and the world. I guess there's been reported 500,000 deaths a year worldwide, 8,000 in the U.S. alone. It's the leading cause of unintentional death, as you can see in younger kids, and then it goes to number 2 in kind of the 5 to 9 range, and still pretty high even for kind of preteens. It's ranked number 5, leading cause of death. And essentially the only thing that matters for this is what do you do, on the scene when you get there. They came out with a bunch of new guidelines in 2002. They got rid of a bunch of stuff. We used to have like this wet drowning, dry drowning. We used to classify freshwater versus saltwater, active versus passive drowning, all this stuff. They got rid of all of it. Now it's just called submersion injuries. So that's essentially how there's no real classifications anymore. Notably, males are more predominant numbers in terms of people who drown than females. So briefly, what happens when you drown? You go underwater for whatever reason, you can't breathe. Sometimes you get this involuntary gasp, sometimes you don't, which kind of classifies if it's wet or dry. You can aspirate. The big thing that everyone gets is laryngospasms. You lose consciousness because you become more hypoxic. You can potentially aspirate again, which can cause you to lose surfactant. And all this eventually leads to the hypoxia and death that you get with drowning injuries. So what do you do when you get called? Big things are you want to correct the hypoxia. Whether they're conscious or not, that'll depend on kind of what you do to fix it. Anything from simple high-flow nasal cannula to intubation and securing the airway. And some of these people, obviously, especially if they've been under for a while, they have a hypoxic arrest. The most common dysrhythmia you'll see with this is a ventricular dysrhythmia. Second most common thing is a bradycardia. Usually it's from the acidosis they get from their hypoxia and not any kind of electrolyte abnormality, so you can give things, typical ACLS, probably won't help. The big thing is to oxygenate them. Everybody wants to try to do this Heimlich maneuver and get them to like cough up whatever water or fluid that they might have ingested. And a lot of the more recent studies have shown that this is actually more ineffective because you're just wasting time with oxygen delivery and the other resuscitation. But this doesn't really help improve outcomes if you try to get them to throw up some water from Heimlich maneuver. Another thing that we see a lot, people come in with sea collars and things, which is important, especially in our context, but over the course of all this data collection, less than 1% of patients actually had an actual spinal cord injury leading to their kind of drowning injury. Things that'll tip you off, I kind of have listed there, if they're abnormally hypotensive, hypotension, things like that. So what do you do if they're awake and they seem to be struggling? Oxygen, like we talked about before. They get bronchospasms, so you can give them albuterol. That helps a lot. Correct any shock. You can put an NG in a Foley. Those are fine to decompress the belly if they swallowed a massive amount of water. Foley is just for when they get to the hospital. We just monitor their urine output. Do a good exam. Is there any obvious trauma? Are they drunk and not really a submergent injury, something like that? Check their temperature, get a good central temperature, because that affects what we do when they get to the hospital too, in terms of if they're coding. We like them to be warm and dead, not cold. There's been many reports of patients 40 minutes plus that have survived, that have been hypothermic, underwater for 40 minutes. We think it's protective. It slows down the metabolism, decreases oxygen consumption. It's kind of cool. So it's important to know what their temperature is. ultimately, if none of this stuff works, kind of a last resort option is ECMO. If you get down to that point, or anytime you have a code from or cardiac arrest from drowning, the outcomes are usually pretty poor. So ECMO is used sometimes, not as often as you think that it might be used. So that's really about all I've got. Kind of heat emergencies and submerging injuries. So questions or anything, concerns?
Cool. Thanks, man.
No problem.
All right. Take 5, we'll come back in.